Thanks, Mr. Chairman. And I, too, thank Chairman Smith for inviting you. And this is an August panel, and it's been very informative, very, very interesting. And I've learned a lot. And I just am very impressed at what we've talked about today. And thank you for being here. Dr. Seestrom, after a tsunami damaged the Fukushima Daiichi nuclear power plant in 2011, massive amounts of seawater cooled the reactor. During cleanup activities, a molecular sieve created by Sandia National Lab scientists was used to extract radioactive cesium from tens of millions of gallons of seawater on the reactor site. It's my understanding that this technology was developed using laboratory-directed research and development, LDRD, funding at Sandia. Can you tell us a little more about how the technology was developed and how it made its way to Japan to play such an important role in the cleanup?
So thank you very much for that question, Congressman. This is actually quite an informative story. So as you probably know, molecular sieves are crystalline substances, and the size of the pores limit the size of molecules that can go through. So the particular technology that was developed at Sandia, in one of our earliest CRADA work with industry, crystalline silico titanate had specific strength for removing cesium. We had a partnership with a company called UOP, actually based, I think, in Des Plaines, Illinois. We licensed it to them. This was back in the 90s. Won an R&D 100 award based on that. When Fukushima came along, one of our eminent senior scientists, the chemist Tina Nenoff, who had worked on disposal of wastes and cleaning of products at Hanford for a long time, was able to quickly test the CST for its applicability to putting the seawater through. It found that it would work just fine, and UOP managed to work with TEPCO in Japan to put that on the ground there.
It's fascinating. That's a great story. So you've talked about LDRD funding being a key part of how the labs pursue new research opportunities. What steps can Congress take to facilitate more of this flexible but mission-focused research?
We'll continue the good work that Congress has done in setting both an upper threshold and a lower threshold for LDRD. We value every penny of that research. I could, if we had time, give you a list of 5 different inventions that came out of our LDRD program that transformed our missions, including our work in rad-hard micro semiconductors. So just keep the limits there for us.
And so I want to talk about the budgeting, because people talked about the CRs and its detrimental impact on all of you. But I'm new to Congress, and we're going to vote on our 7th CR in 6 months, and I'm kind of embarrassed by that. I hope there's not enough people in here to join me in my embarrassment. But over the last 20 years, we've done more than 100 CRs, an average of 5, in excess of 5, almost 6 CRs per year. And I realize that it's detrimental, but is it baked in at all in your budgeting as you the fact that it looks to me like budgeting in some ways is actually reasonably stable, but with this kind of crazy blip every 2 or 3 months where we say, well, we're going to shut down government for a weekend or whatever it may be. Is it baked in at all, or can you elaborate on that? I guess what I'm trying to say.
Well, given that it's as you note, an annual occurrence, we understand how to manage through it. But I would never say that it's a good thing, because it's the constant challenge to keep the staff excited and motivated when you're going through this. Particularly, I'll also particularly note the early career staff. Some of us, we've been through this for a long time, but the early career staff watch this and they say, why am I at a lab? Why don't I go work somewhere else? So it's a challenge. So the more we get to regular order and stable research funding, the better we can innovate.
Well, don't get me wrong. I'm not saying that that's the way to do it. I'm all with you on a.
Yeah, I understand, but it does. But I'm just reacting to it's baked in the sense that from the management perspective, we know how to manage it. But that doesn't mean that the staff don't get put through a lot of churn.
Yeah.
But I would say we're all used to, after 30 years, seeing continuing resolutions for a month or two. But the length that we're going now is really hard to deal with, and programs begin to lose funding, and it's particularly hard on new starting projects, which can't get going in a CR.
We did one from December 8th to December 22nd this year. How idiotic. I mean, last year. Anyway, sorry, Dr.
Yeah, I was going to comment as well. I think a couple of things. And one is it is particularly difficult for early career scientists because it creates uncertainty. And, of course, they have lots of opportunities to go other places, as has already been mentioned by the panel. I think it's critical that during this time of uncertainty, the laboratory directors need to show some leadership and really step out front and talk about it being a process and also share our experience in terms of positive outcomes. I would also say, though, it really is, has just been commented by Susan in terms of impact on new starts or construction activities, or perhaps not a new start, but where a ramp up in funding is really planned for an ongoing project is particularly critical. You know, certainly the advanced photon source at Argonne has suffered this time and time again, and so we're really pleased with the indications of the FY18 budget, and hopefully the FY19 budget will show a different story, but really it creates a lag, takes away a sense of urgency. It really kind of challenges us to really stay at the edge in terms of our thinking, so it's important that we're able to move forward.
Yes, and I will just tell you that I'll keep pushing for us to do an annual budget so everybody can be more stable and more predictable. So again, thank you for being here. Thank you, Mr. Chairman.